We're ready to begin. Divide your patient's face in half along the medial axis, since you will be treating one side at a time. Using a skin marker, divide each half into 3 bilateral sections and mark them. Each one is a distinct treatment area. At this point, have your patient lie down on the bed and apply a small amount of treatment oil for lubrication as the handpiece is moved across the skin. Explain to the patient that during the course of the session, she should expect to feel heat sensation in the area being treated, but that the level of heat should always be comfortable. The heat sensation will intensify gradually until the therapeutic range is reached. If she begins to experience an uncomfortable level of heat, she should indicate this to you, and you will immediately stop delivering heating energy and apply cooling only. She should feel the temperature drop. For the facial area, we will be using both the bipolar and the unipolar handpieces. For the mid-face area, we will use the unipolar handpiece, setting the energy parameter on the system to 90 to 100 watts. Set the exposure time to 30 seconds, the standard time for each pass. At the end of each pass, the handpiece will automatically stop transmitting energy. The cooling mode is preset to on, so that the handpiece automatically cools when not delivering heat. Press the standby button in order to enter the ready mode, and you're all set to go. For unusually sensitive skin, or in sensitive areas, reduce the energy level by 10 watts and refer to the clinical guide in the operator's manual. We will now begin treatment in the mid-face area. There are 2 phases to each treatment session. The pre-therapeutic phase, which should take about 2 passes, is the phase during which you will bring your patient's temperature to between 39 and 44 degrees Celsius. This is followed by the therapeutic phase, during which you will maintain that temperature for 3 to 4 passes. The very first step is to measure your patient's baseline skin temperature with a laser thermometer, holding the thermometer 10 centimeters from the treated area. Keep your thermometer handy for the duration of the treatment. On the handpiece, there is a trigger that initiates the release of energy. Be sure to first make complete contact with the skin and start moving the handpiece before pressing the trigger. When you press the trigger, the system will emit a low beeping sound to let you know that radiofrequency energy is being released from the handpiece, and the blue LED on the handpiece will be illuminated. Apply the handpiece in a continuous circular motion in constant contact with the skin. Keep the handpiece constantly moving until the end of the pass. The continuous circular motion is used to provide a more comfortable experience for the patient. If you release the trigger in the course of a 30-second pass, the handpiece will stop releasing RF energy. At the end of the 30-second pass, the system will emit a long beep to let you know that energy transmission has stopped, and the blue LED will blink. Check your patient's temperature. Once your patient's skin temperature has reached the therapeutic range, you are ready to begin the therapeutic phase. The goal of this phase is to maintain the therapeutic temperature level for 3 to 4 passes in order to induce the desired effects on the tissue. The first step before resuming treatment is to reduce the energy setting on the system by 10 watts, since it will require less energy to maintain your patient's temperature than it did to increase it initially. Continue to check your patient's temperature after each pass. After every other pass, we recommend that you briefly massage the treatment area in the direction of the adjacent lymph nodes in order to promote draining of excess fluids. After this, gently remove the treatment oil and place a cool wet cloth on the treated area. Apply aloe vera-based moisturizing lotion to enhance cooling and rehydration of the skin. To treat the nasolabial fold, use the unipolar handpiece, with the energy set at 90 watts. With one hand, flatten the fold by stretching the skin, and, with the other hand, move the handpiece upwards and downwards directly on the fold, pressing the trigger to emit energy for 2 to 3 seconds, and then releasing the trigger for cooling for 2 to 3 seconds. This alternating technique should be performed for 1 complete pass. Also, make sure that the tip of the handpiece does not touch the sensitive tissue on the side of the nostril. To treat the forehead and crow's feet areas, we will use the bipolar handpiece with the energy set at 60 watts. The heat sensation experienced with the bipolar handpiece is more superficial, while the heat generated by the unipolar handpiece builds up from deeper within the tissue. Treatments above and below the orbital area are done with a unipolar handpiece. Using one hand to stretch the skin away from the eye, move the handpiece back and forth directly on the fold with your other hand, pressing the trigger for 2 to 3 seconds, and then releasing it for 2 to 3 seconds. Again, this alternating technique should be performed for 1 complete pass. Be sure to treat only outside the orbital area. The treatment of fine lines and wrinkles with the accent system achieves visible results, as you can see from these photographs.